Hello, everyone. Happy Monday. My name is Shalaya Yazdi. I'm a public health practitioner and a Master's of Medical Health Science student at Touro University. Since the pandemic began, people around the world experienced a shift from their normal routines. We've had to change so much in our lifestyles and also need to keep in mind that we need to address the conditions that we are living in. And so many individuals around the world have been touched by diabetes and have a story about it. And tonight, I'm really excited to share with you that we're going to be discussing how to take charge to prevent diabetes. So I would like to introduce Nikki Hardwick and Dr. Shubrook, who are here tonight to share Nikki's story about diabetes. And I'd also like to share more information with you about Zoom into Wellness. We have had quite a journey thus far, and it's all because our incredible guest speakers and student moderators and all of our attendees throughout the past few months who have encouraged us to continue this conversation about health and wellness. And this spring, we're going to be discussing more about diabetes and various aspects of diabetes, including neuropathy, retinopathy, and taking charge to prevent diabetes. So thank you so much, Nikki Hardwick and Dr. Shubrook. I will open up the conversation for you now. Any participants have any questions, please feel free to enter them in the Q&A portion of the Zoom. Thank you.
Thank you. Nikki, it's great to see you.
Thank you. It's great to be here.
Yeah. I want to thank everyone who's joined us tonight and say that as we head into a new year in 2021, we've had just a very successful Black History Month that just completed. Today is International Women's Day, and there is a lot for us to be looking forward to, remembering, but also growing and building a better future. And tonight, I'm just delighted to be able to spend time with Nikki and all of you to talk about success stories. And just as a very short background, because you'll get to know Nikki quite well tonight. I've had the luxury of working with Nikki in her role as a nurse at Family Health Services at Solano County, and she serves as a leader of the team in our unit and helps to keep everyone, including me, straight. And anyone that knows what it is to keep me straight, it is no small task, as Nikki can attest to smiling. But I would also want to congratulate her because she's taking her leadership to another level and just completed her master's in nursing and got her MSN just last December, and is moving not only to a champion within her work unit, but also moving forward as an educator and a community activist, and has been involved in many of our programs. So Nikki, I'm just so pleased that you're willing to give us some of your time and share some of your wisdom.
Thank you. I'm glad to be here.
Yeah, and we're glad too. For everyone in the audience, please feel free to put questions into the chat and the Q&A. Please into the Q&A. I'll make sure that we get those answered as well. But first, tonight is talking about success stories. And so I'd love to hear from you, Nikki, about maybe your diabetes story. You know, that's how I open most of my intakes is, what is your diabetes story?
So my diabetes story is both my parents had diabetes. So just being a nurse, you know, that puts me at 50% chance of getting diabetes. And so I think my journey actually started back in 2010. I was working at San Francisco General Hospital, and at that time I was working in the ER, and I transitioned from there to more of an admin to informatics. So I wasn't working the 3-day, 12-hour shifts anymore. So I was commuting 4 hours a day, 5 days a week, Monday through Friday. My hours were 8 to 5. So that being said, my lifestyle, like my eating, my nutrition was very poor. I ate maybe one meal a day, and it was probably bread and butter, things like that, because I was just commuting under a lot of stress. Also in 2010, my mom had to come and live with me because she had dementia. So I was trying to work, trying to take care of her. And so I was basically overweight, stressed out, not eating right. And that just progressed over the years until 2017 when I met Dr. Shubrook working at the county, because my hemoglobin A1C was climbing each year. It was getting higher and higher. And to be honest, I was under so much stress of just life and trying to manage life. I couldn't really deal with it, or I chose not to deal with it. But in 2017, when I met Dr. Shubrook, and he was in the clinic, and I just talked to him, about my situation, and he was like, "You can turn that around. Like, you can turn it around." So my hemoglobin A1C was 6 at that time, but it had it climbed up from 5.4. So it seemed like every year it was getting higher and higher. So what I did was I changed my diet. And one of the medical assistants that work at the clinic invited me to her boxing boot camp class. And I actually saw her this morning and told her that she was part of my story, because she is. I'm still doing that class. Here we are, 4 years later. So I started exercising and I started changing the way I eat. And my blood pressure went down. I got off blood pressure meds as of January 2019.
Wow.
My hemoglobin A1C went down to 5.6. I lost 40 pounds. And this was all just by making a lifestyle change. And that's kind of what I want to talk to in more depth about today, is that, you can turn the numbers back. You can make a change. You just have to change things in your life. And it, stress was a big part of it. Mom passed away in 2018, which I just feel like that's important to say too, because we have to be aware of the stressors in our life, and we have to still find a way to do self-care, because stress does negatively impact our health as well. Yeah. In a great way. So that's where we are today. That's my diabetes story.
Well, and that's there's so much that you've said there, right? You said that you had some awareness of your pre-diabetes status, and that's not something a lot of people are aware of. Quite honestly, as you tell your story in a different circle, it might be a success story. Like, oh, here's this nurse who's very productive working in San Francisco, high-powered job, working, and so often I think that our messages are messages of a busy and American striving to succeed, but often at our own expense. Mm-hmm. So you made some pivots, and I guess I'd like to hear some thoughts about those pivots, because you did change jobs, but you also, that's no small feat you did. So there's a lot of description in the middle there that maybe we need to have some understanding with, because it is a tough thing you did.
Yes, and it was. So I had been at San Francisco General for 20 years. I started there as an LVN, and then I got my RN, but it was an associate's degree. So I was a degree, registered nurse. I didn't have my BSN. So I went there in 1994. And so now here it is. I didn't leave until 2015. And it was very scary, because I was comfortable there. It's a city and county. My job was secure. And I said, like, where am I going to go? Like, times are different now. It's 2015. I don't have my bachelor's. Yes, I have a gang of experience, but like, am I going to be able to get another job? Like, it was a lot of fear. But the 4-hour commute was killing me. And it was actually the head of the skilled nursing. We had a skilled nursing unit in San Francisco General. And the head of the nursing unit we were very close. We were very, very close. And one day she said to me in the hall, I never will forget it. She said, "Nikki, your kids are done with college. Like, you've done everything you need to do. Why are you still here?" She said, "I see you dying right in front of me." She said, "You're not healthy, and I'm watching you die, and I don't like that." And that was very, very powerful to me, because she had basically watched me grow, since I started there. And for her to tell me that I'm watching you die in front of me, that was an eye opener for me. So at that point, I said, okay, well, I've been here 20 years, and in my contract, 20 years of service or age 50, whichever comes first, you can retire with your medical and your benefits. So that's what I did. That's what I did. And I said, I'm just going to go out on faith. And I said, you know, something else is gonna come my way. And I ended up in Solano County. I got a postcard in my mailbox. I didn't seek the position. I didn't even know that Solano County had a clinic, like, because I'm not from here, you know, I didn't know. And I got this little postcard in the mailbox that said, we're looking for a senior clinic RN. And I was just like, okay, let me do this, because I was working as a team leader for Vitas. I was doing hospice at the time. And I liked it. You know, I had never done hospice before, but I had been there since I left general and it was okay. But I applied for the position with the county and it snowballed. You know, normally the county takes quite a while for the hiring process. And I got hired in the county within 6 weeks.
Wow.
I got an interview right away and I started. So that was the first thing I did. And that gave me, I'm 10 minutes away from home. It's Monday through Friday, you know, and that decreased a lot of stress in my life. So that was the first step. And the second step was my daughter worked for Omada Health. It's a digital health company. And they had a program called Prevent. And because she worked there, she gave me one of the comp passes to go through the Prevent program. And I went through that program and it was amazing. I had told Ann Lee from our DPP program, it's kind of similar to what we have here at Touro. And I had a life coach and they taught me to journal my food, to write down everything I eat, to read labels, to see what's in the food. And all of that helped with my transition to becoming more healthy. And that I started that in 2016. And to this day, I still read labels. I actually measure my food because my life has changed so much. I'm on no medication. Like I said, I haven't been since 2019. I exercise 5 days a week and I'm addicted to it. So my quality of life is so much better that I don't want to lose it. You know, I don't want to lose it. And that's kind of how I got to where I am today as far as the transition.
And how did you find the time? Because, you know, as you describe all this, you know, reading labels, doing things, increasing your physical activity, those are things that like take a lot of time. And is it just the 4-hour drive or what else did you do to create the time to make these changes?
My work schedule really helped being so close to work. As far as my exercise, I get up at 4 in the morning because I exercise from 5 to 6 before work. I try to like exercise after work, but after my work day, I don't have it in me. I just won't make it. So it's a, you know, it's a sacrifice, but I get up at 4 in the morning before work so I can go and exercise. And then as far as the food, I make a shopping list and I have a whiteboard on my refrigerator. And so as I run out of things, I make my list. And I wanted to talk about that later about like how to tell people how to shop. But you have to plan. You're right. It takes time, but it takes organization. And I think more importantly, it has to be something that you intentionally do. You have to intentionally, you know, make time to do it. Like you have to plan it, set a schedule, work it out, see what your work schedule is, see when you have free time. And it has to be planned. It's intentional.
Had you tried things similarly in the past and didn't work? Or was this like home run first time around?
I didn't try things in the past because I didn't have the opportunity to.
Mm-hmm.
When I became aware, like I said, the Prevent program was the first experience I had. And I just stuck with that. And like I said, it helped me so much. I was just like, oh, okay. Because I mean, I just felt horrible. I was sluggish all the time. I had no energy. um, I just felt bad, you know, and I was like, this is not good, you know, but I didn't have like symptoms of diabetes or not yet, you know, but I didn't want it to progress to that point because I was significantly overweight. Like my daughter makes a joke. She says I had 3 stomachs. And, but mind you, nobody told me that at the time.
Well, and I don't think anyone other than your family could say that. I mean, so I had a question that also came from the audience as well. So if you get up at 4 a.m., what time do you go to bed?
I go to bed around, I physically go to bed 9:30, 10. I probably will fall asleep before 11, a little before 11. And that's another thing. Like I sleep maybe 4 to 5 hours a night, but I'm not tired. The exercise really does give you energy, and I'm in a routine now, and I don't get sluggish during the day. Like, you know, the exercise gives me juice to go and start my day.
So you had mentioned that you knew your A1C and it was climbing, and you got the shot in your arm when your coworker had said that she was watching you die. And of course, that's a very powerful message, especially if it's someone that you look up to or you trust. How did you know that it was time to act? And maybe that was the shot in the arm, because I see so many people with prediabetes, and I worry that we just wait. Well, it's not diabetes yet. It's not diabetes yet. So, what I guess, any advice about moving forward, not letting it wait till it becomes diabetes?
The reason I didn't, and like I said, it was Dr. Kaimbashi, and I'm going to say her name. It was her telling me because I couldn't see myself. It's really funny, you know, you just get up every day. I mean, you shower, you wash your face, you're in a mirror, but you don't really see yourself as others see you. And so for her telling me like the life is sucking out of you, you know, and she told me, I'm watching you die in front of me. And like you said, that was powerful. And I just was like, and I knew she loved me. Like I said, she mentored me, and she actually cared about me as a person. And she was saying like, you don't have to do this anymore. You know, it's okay. You need to make a change. And that was the turning point for me. And I'm, you know, so grateful to this day that, you know, I had her in my life, because she was person bold enough to say, I'm watching you die. Like, you look terrible, you know, and that's what it was, you know.
So if, let's say, not everyone has that mentor, has that possibility, what advice would you give to community members who maybe have gotten that news and are trying to take a step moving forward?
So the advice I would give is, if you're one where you've gotten a diagnosis, like, you know, they told you were diabetic, you know, it doesn't have to be a death sentence. It doesn't have to be where, you know, you lose limbs and you can't have this and you can't have that. I think that, I know for people I know, a lot of the people in my community who look like me, who have diabetes, they correlate it with everything you can't have, you know.
Yeah.
And they also correlate it with, well, you know, my mom had, and you know, they call it, my mom had sugar, and you know, my grandmother had it, and it's just a way of life. We just, you know, I just have it. And I would say that if you get that diagnosis, you know, you need to make a lifestyle change. Small, simple steps. You can't change everything all at once, but you have to first do some self-examination in your life and see in what areas can you make change. Because unfortunately, I mean, as for me initially, some areas in your life you may not be able to change at that moment. So it's important to change the things you can. Take control over the things that you can take control over. And we definitely can take control over our nutritional intake. You know what I'm saying? We have a certain amount of control over that. As far as a work schedule, you know, someone might be stressed and can't really exercise or exercise outside or whatever. but I mean, you can just move in your house. You can march in place. Like you can just make sure that you move. But you have to start somewhere. And that's what I would tell someone in the community. If you already have been given that diagnosis, you have to start, make the change, because it can be positive. You know, diabetes does not have to be negative. You can live with it, and you can make changes to reverse the consequences of diabetes.
Every time you say that you stopped medication, I see that smile. I love that smile every time you say that, because it really is something that I think many people feel is unattainable.
No,
Right.
it's very attainable. I was on blood pressure medication, cholesterol medication. I had terrible migraines. They had me on medication for my headache. I have spinal stenosis. It's in my cervical region between C4 and C6. So they had me on medication for that. And I know we're talking about diabetes, but I just want to throw in there, when I became to eat healthier and I lost weight, I had no more problems with my spine. And it's amazing. My spine used to bother me to the point to where like I couldn't walk. It was very, very painful. So I'm saying all that to say, taking charge of your health, you can get off medications. You can, improve your health, even if you have a disease diagnosis. It's a great benefit to be healthy.
Yeah, it's really inspiring. So, day to day, you're making all these changes, and I'd like to think that often a powerful person can do it, but often we need support. So, in your day to day life, I imagine some days you may not want to get up at 4 a.m., or maybe you want to do something different. What helps you to continue to move forward, or who helps you to continue to move forward in your life? Because I think too often we soldier on, is the term I would often use. And I think that's sometimes hard to do alone.
No, you cannot do it alone. I didn't do it alone. You need a support system. So my support system for me getting up in the morning to work out is my boxing crew. Even with, I'm recovering from an Achilles reattachment surgery. So I hadn't been able to work out since like October. And that was, a mental thing for me. I was trying to push through because working out makes me feel better. It makes me feel better mentally and physically. And so they would, send me text messages. We're thinking about you. You got this. So the support to keep me going, you know what I'm saying? So I had a support network there. I also had a support network at my job, at my workplace, because they know that what I'm trying to do. And I would bring like sugar-free creamer, and then I would get other people, and they're like, oh, you're doing so good. Oh my God, you're looking so great. And so it kind of spread. It's kind of contagious, and they're like, oh, I want to go and do this. And like my LVN Dina, she started, with the sugar-free creamers for coffee. And she's like, man, this is not bad. So it kind of is encouraging when you see your journey and you're sharing your journey meaning that your lifestyle change, you're sharing what you're doing, and people can see a difference in you, like they can physically see the change. So that kind of motivates you at that point, because you're not really doing it for you. And for me, I'm not really doing it for me anymore, but I feel an accountability that I have to push through to share what I've done so that I can help someone else. Because if they can see what it did for me, they're more inclined to say, hey, maybe I can. But you really can't do this journey by yourself. And it is a lifelong journey. But what I want to say is that I do have times where I celebrate my sacrifice. Like I don't, Monday through Friday, I have a system. Monday through Friday, I'm really disciplined in my meals. And I weigh my food, and I bring my food. Like I don't eat fast food. I bring my food to lunch, to my food to work every day for lunch. But on Saturday, when my husband, we go out, if I want to have a scoop of ice cream, I have a scoop of ice cream. You know, it's a scoop of ice cream on that one day, but it's not that I'm eating ice cream and junk and processed foods every day. You know, so you have to learn to celebrate yourself and celebrate your victories, because you don't want to feel like you're losing something. And I think that that's with diabetes, that's what keeps a lot of people stuck, because they look at diabetes and they're like, oh man, you know, I can't have sugar, I can't have this, I can't have that. And you just think about what you can have. And I just want to, I want to challenge, you know, the community. Don't look at it as in what you can't have. Just make accommodations and view it as, okay, I can do this as opposed to this, you know? And I think that that's a more positive way to look at it that will produce better results.
And you get to feel better, right? That's the other thing, is you actually physically feel better. So
You physically feel amazing.
moving from that scarcity mentality to an abundance mentality, and it's being healthy along the way. That's wonderful.
And I think it's important, and the reason why I'm really passionate about sharing my story with diabetes, in order for us to build healthy communities, we have to start by building healthy families.
Mm.
And when I say healthy families, I mean our children. I'm thinking back to my 2 children, and I was a single mom. I was a single mom the whole time. I got married when my son graduated high school and my daughter was in her freshman year of college. But I see kids today and I see like the stuff that they eat and drink. My kids never got soda. And that's only because I was a nurse then, you know what I'm saying? I was an LVN and I had a little knowledge, but they did get juice. And back then they got juice with sugar because I didn't know any better. But I noticed that even in high school and college, and to this day, my kids still don't drink soda, you know, and they're not sweets eaters and things like that, because they never got that. Like, it was a special occasion. They had to like bring home an A or bring me good grades, or it was a birthday or something like that. And then, you know, they got rewarded. But, you know, the rate of childhood obesity in our country, like, it's just, you know, it's really, really bad. And I think that we have to start at a young age to give our children healthier food so that they grow up and we'll have healthier communities that way. Because if we don't make a change with the children, we're never going to reach that point of truly having healthy communities.
Yeah, I think you're right. And, you know, sometimes it's hard. You know, I think of some of the challenges that I see kind of day in and day out. Sometimes it's financial. You know, can I afford to get what I think is healthy food? Sometimes it's safety. Is it safe to leave my house to do things? And you've addressed some of those things, but knowing that we have a lot of challenges in our community, we have incredible communities, but we also have some real challenges. Any suggestions of how to you know, live within our environment, but also be healthy within our environment?
You spoke about financial, and, you know, I've heard when I try to talk to people, they say, well, it's healthy food is so expensive. And yes, it can be. But, you know, and I know in Vallejo, we have a farmer's market where you can just get like greens and fruit and things like that. What I find is that eating healthy takes more work. It can be more expensive, but you can buy like a big thing of spinach for $5 at Safeway, and that will last you all week. You know what I'm saying? You can buy a big thing of spinach.
You have to eat it, because
I'm
otherwise
sorry.
it goes bad. You have to eat it or it goes bad.
Well, I was thinking if you had a family, I'm thinking as a single mom with kids, I'm saying like that, you know, that would last you. But yeah, you do have to eat it, but we're supposed to be eating vegetables like 4 times a day, right? So it wouldn't go bad. But that's my suggestion. Like, it just, like I said, planning your meals. I think that in addition to financial, the way parents have to work now, you know, our kids, you know, you might have one parent or 2 parents working, and they're constant, you know, it's busy. They don't really have the time to prepare food, or when they do get home from work, they're probably so mentally tired, which is why I suggest meal prepping, like on Sunday. And you just and maybe if you can't meal prep all the way to Friday, but at least Monday, Tuesday, Wednesday, that's something. And that's what I'm saying about setting like small goals, making small changes. Do what you can. And if you meal prep for, you know, the 3 days, when you get home from work, the kids already have a healthy meal, the family has a healthy meal, you can all eat together, and you don't, you know, you can de-stress, unwind, have family time, and not have to run in the house. Oh God, what am I going to feed the kids? Because I've been there, you know, I know what that's like. I worked 12-hour night shift, went to school during the day, single parent of 2 that played every sport there was. My daughter might even be on listening to this, but it, you know, it's hard, and it does take some juggling, but I guess like I'm here to say that it can be done, you know, it can be done, but you need a good support system, whether it's family, whether it's a faith-based organization, whether it's your coworkers, colleagues, like whatever works for you, a best friend, but you do need a support system to help you walk on this journey. You really do.
Yeah, and you've addressed one of the things that I was going to ask you, and one of the community members had asked was, you know, we have the luxury of having some knowledge because we're in the healthcare industry, but lots of people don't have that knowledge, and sometimes even people in healthcare don't have the knowledge. But if someone doesn't know, and maybe they have a family history, what do you suggest? I mean, how do people start to learn, and how do people find that support? And you talked about that we have to kind of think of our family as support, and maybe even redefine our family as our place of worship or the place that we work, because they all could be members of our support team. But where would you send people for information, and how do you help to share that?
Well, I would send people the information to Touro.
Yeah, but Touro one place. What are some other places though?
I would send them, it depends on their literacy, Dr. Shubrook, really, because there's, you know, the American Diabetes Association, the website that has a lot of information, is as well as the American Heart Association. So it depends on their literacy and their access to electronics. If, you know, they don't have that, I would send them to their clinic, you know, if depending on where they got their health care from. You know, if they're not on private insurance, I would send them to the community clinic, because there's a lot of information there. It just depends on their circumstance, because everyone doesn't, you know, doesn't fit in a particular bubble, but it depends, you know. But there's a lot of information that you can learn on the websites for both, you know, American Heart and the American Diabetes Association.
And I know that we live in a day and age where trust is a real issue. And I know that sometimes there's even mistrust, and rightly so if we look at our history, even the medical complex and research. And so how do we help people get the information they need so that they can take action to be well, and work with partners that they trust? Because I feel like we all should have a healthcare team that we trust.
So that's a challenge, and I'm just going to speak for my community, meaning the African American community, because I do know it. I am an African American woman, and we have significant trust issues. And I have noticed that in the place where in the clinic I work, my presence there is more effectual with patients of color, specifically African American patients. Like my clinic RN can give them the same information and it not be accepted, it not be received. And then of course they call me because I'm the supervisor, and I go and I give the same information. But I think that, you know, within different cultures, there's communication style, there's language, you know, the style of language, and just the presence of talking to someone who looks like you, who you feel like you have similarities with, who you feel understands your plight, you know, just because. And that's a barrier because there's not enough. I don't feel there's not enough in the healthcare profession. It just really is. And
There's
to
no
break
doubt.
down to break down those trust barriers, and that's kind of like for me why I just want to be a voice. But you know, community members aren't necessarily going to come to seek health care or to the provider until something's wrong. And that's for a variety of reasons. Most times it's life is so intense. They're trying to work, they're trying to, you know, pay their rent or their mortgage, keep, you know, they're going through life. So their health is really not a priority just because of the struggle. And that's just what it is. So they're going to show up when they have to, you know, and by that time, we probably have a lot of problems that we have to deal with. And then I think that leads to, you know, the whole idea of fatalism. Like they just at this point, oh my God, you know, what can I do? So you know, I just feel like I don't know how we can do it, but I know that we need to just reach the community, like things like this, reach the community, not with our scrubs, not with our white coats, just talk to people. I did my final project at the homeless shelter across on Beck in Fairfield. And it was really, really nice. You know, we did a one-day health fair and we were educating them on blood pressure and diabetes. And we were doing blood sugar checks and things like that. And people were just coming up and just talking, and you just got to talk to people. And it seemed like they were much more open, you know, just, you know, we didn't come at them with the medical stuff first. We just wanted to talk to them. We had like food, we had music, and the environment was so laid back and welcoming that we were able to share the information, and it was, you know, received in a very positive way. And they were asking questions. And like, I remember one particular participant, he didn't know that TV dinners had a lot of salt. But he was like, that's all I buy because, you know, they're cheap and da 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 da. But he was just like, and I just got told that I had high blood pressure, you know, and he was like, it was like a light bulb. He was like, oh, okay, I'm not going to buy any more TV dinners. Like, you know, we were able to provide him education. So that was a win, even if it was just one person. Like, and I remember him specifically because that was a win because he left that fair, you know, making a lifestyle change that he didn't want any more TV dinners. But we wouldn't have saw him in the clinic or in Kaiser or in NorthBay. You know, we had to actually go to the community.
Yeah. And I think you say so many important things that one, we all have moments where there are key moments where we can make decisions and the information's in front of us. Two, we have to be in a place where people feel trusted and are open to information. And then I think three, having mentors and community leaders that can communicate a message of positivity is really important. I think that, you know, often if all you see is, you know, I get diabetes and I have an amputation, or I get prediabetes and so I'm going to get diabetes, and you don't get to hear the positive stories, then of course that's what you're going to think, right? That's your lived experience. And so that's one of the things that I think that makes your message so powerful is that, you know, knowing all the odds you were fighting, you found a way, and you continue to find a way, quite honestly. And now you're sharing that with the community, which I think is just absolutely incredible.
I want to say also, you know, it's not only that you mentioned that once they get diabetes, they're like, oh, I'm going to lose a limb. They feel that way because everyone they know, like in their environment, their family, and in their inner circle, that's what they've seen. And like you say, it's very important to have success stories, because especially to have a success story for someone that looks like them. Because, you know, in their culture, everyone they see, they're losing limbs, they're going blind, and it's just, you know, a way of acceptance. So, you know, it's very powerful.
Mm-hmm. Did you happen to have any interaction with your healthcare team through this process, or was this largely done independently?
It was largely done independently. Honestly, you know, I would just, my labs would come back and the doctor would say, you know, you need to lose some weight. Like it's an automated generated response. And I have private health insurance, but there was no one-to-one. There was no like formal teaching, like, or suggestions, or sending me to, you know, like a nutritionist, or there wasn't. And there just, it didn't happen. Now, I'm not saying that that's not the case for everybody, but, you know, my particular primary care provider didn't offer that. And I kind of think it could be because I'm a nurse, and it just might be that thing that they just kind of feel like, well, you know what to do. I don't know why, but it wasn't anything to do with my primary care provider.
Well, and I knew that, and I think that, again, this is no disrespect to any other healthcare provider, but too often, as a physician, I speak on behalf of the physicians I know, we're very quick to write prescriptions, but we're not always very quick to help people take charge of their own health. And so that it can be a shortcoming of the healthcare system. And so while you can get good information from the healthcare system, I think it's also okay to be open to other ideas, particularly ones where you can take charge of your health. And quite honestly, I love it when a patient will come back to me and say, hey, I learned about this program. What do you think? Mm-hmm. Because then I give a chance to give you some information about safety, but you're also taking charge. So, I love that. We do have the questions come in a couple times. Everybody wants to know about this boxing. Can you tell us more about this boxing that you do?
Okay, so it's in Sassoon. It's called Train for Life Fitness, and it's called a boxing boot camp. But I can't box. When I first joined, my coach said to me, he was like, the way you hit, I could tell you've never hit anybody in your life. And I was just like, no, I haven't. He was like, it shows in your punch. But for the first 30 minutes, we warm up for 15 minutes, and it's just cardio. We might do the steps. He might make us run laps around the gym, but we warm up, and then we lift weights. It's dumbbells, barbells. We do ab work, we do crunches, we do squats for the next 15 minutes. And then the last 30 minutes, we go to the bags, and you just punch, punch, punch. He'll have you do uppercuts and punches. And then sometimes we're doing crunches on the bags. We have to lay on the floor, wrap our legs around the bags, and do sit-ups and things. And it's all done to music. And my 5 a.m. class consists of 4 people because it's so early. But I hear the other classes that they offer, like at 5:30 and 6:30, they have a lot of people. But, we push each other, and our coach pushes us. So that's the boxing boot camp that we do. And I've been in it now since 2018.
And you like the structure in the group because the group keeps you accountable.
Yes. So right now, and they always have little different things. Right now we're doing a 21-day challenge. Like I said, I'm limited because of my Achilles, but I'm doing the nutrition piece, which is he will take your weight and your body mass index and your percentage of body fat and calculate how many calories a day you can eat. And you have to drink a gallon of water a day.
Wow, a gallon.
A gallon.
Wow.
During the course of the day.
You have to be close to a bathroom.
Exactly, because
So, this is not a question I had planned on, but I think you talked about this, and I think it's important. We all have setbacks in our life. And so, your Achilles injury surely must have changed your plan. So how did you adjust? Because I could see that easily, derailing someone's efforts.
I'm still adjusting, to be honest. It's hard. I'm 11 weeks out from my surgery. I'm thankful that I can walk without, crutches or any assistive devices, but I'm still very slow. Like I have a long ways to go to recover. It made me more determined and more diligent in my diet because I knew I couldn't work out, and I knew my body was used to working out 5 days a week. So how I made the adjustment, since I was home from work anyway, like I'm home, I can't go anywhere. I couldn't even walk. I literally, like I said, I weigh my food. I made my list and sent my husband to the store, and I eat things like Like my snack will be beets and artichoke hearts. I'll have that, just a little, but it's just like 2 beets. And, I really measure my food, in a palm of my hand. And initially it was hard. I was just like, I'm going to be hungry. Like, I'm going to be hungry. And my thing was, I loved bread, potatoes, rice. That basically was, I'm sure it was like 80% of my diet. Literally, I would just sit down and get, some French bread, get some butter, and like, I'm good. I had a meal. But then I looked like a loaf of bread too. Like that's why I was so fluffy. But giving up, initially I gave up the white bread and gave up the carbs and done all the stuff. And it was hard. But what I do want to say is, if you can just get through that first, I think it's like the first 90 days, you start to lose the desire for it. If you can, if you can maintain with your support, you really will. I know it doesn't sound like you will, but I'm telling you, you will lose the desire for it. And even more so, if you change the way you eat, you won't be able to go back to the other way. Because if you do, like, I tried to eat this bread that was really rich and it made my stomach hurt. Like, initially my stomach started cramping and I'm like, oh, I won't do that no more. But it had been, over a year since I've eaten that type of bread. Mm-hmm. So if I have a slice of bread now, it's wheat, it's whole grain wheat bread, and it's very limited. But my point is, over time, you lose the sugar cravings. If you limit the sugar, you lose the carb cravings, and you crave the vegetables. Like for me, I have to have something green on my plate for dinner. I can't. My husband will cook me dinner, especially with my Achilles. I'm like, can you just go make me a salad or something? Like, my body craves it now. And I would have never, ever thought that, because I didn't grow up eating vegetables. I grew up, my mom was on welfare. I never got fresh vegetables or fresh fruit ever. I didn't miss it because I didn't know about it. Like looking back on it now, I'm like, wow, we got fruit cocktail in a can and all, all the canned stuff. So, but yeah, yeah.
So you've joined SODAF, Solano County Diabetes Advisory Forum. And so this is a plug, but also just a question. This is an active group of community members that have, committed some time to get the word out about being healthy. And I don't want to take Kaiser's word of thrive, but thriving and maximizing our health. What interests you about SODAF?
The fact that it consisted of community members, and that I could be a part to engage with the community, because that's really my passion right now. And that SODAF led me to 2 other like support groups for diabetes, and I attend and I share. And I don't, have diabetes, but it's not necessarily for people that actually have it. You could be you could have someone in your family have it, or a mother of a child who has it, just anyone that has diabetes affecting their life. And it's really, really, really nice to be a part of the support. Like, people share stories about just what they're going through with their meds, or sometimes we just talk about, like, I had a terrible day today and I just I don't feel good, it was a frustrating day or whatever. And just to have that community support. My role, sometimes they'll just bring in, because I am clinical, they'll come and ask me a clinical question. But most of the time, I just am there as a community member, just to, I'm a resource if needed. But it's really, really nice. And I love being a part of SODAF. Wow. I really do.
And if anyone out there has an interest in SODAF, to make it easiest, you can call 707-638-5970 and leave a message. And Maya Ramsey will reach out, or I will reach out to talk with you about it, because we certainly are open, and we want to have an active community that has information, and we want to partner with you. So Nikki, if you had to leave one message for the community that you would say, this is the best advice I could give you, what would that be?
To take charge of their own health, that they are in control of their health, and you can make a change. Like, you can do it. You know, you have to own it, you know, and in owning it, I just need to put this, in owning it, you have to accept it. And many times we could know something, but we push it here. You know what I'm saying? Like I said, we're not going to deal with it until we have to. So I think that's the take home message, is we have to accept our situation, whatever it is, look at it, analyze it, and see in what area we want to start the change, because the change is a lifelong journey. You never arrive, because once you feel like you've arrived, you know, you're deceiving yourself. You never arrive. It's a process that you have to continue for the rest of your life.
Wow. In the chat, there's also a sign up for the support group, which is free and open to the public. And, you know, I want to thank you for spending an hour with us, Nikki. I am always just inspired and so impressed by what you've done, you know, not only on the work side, but on the personal side. And when you live, you live consistently with the things that you're talking about, it is just so amazing. And I know that it is a lot of work. And, you know, I am just, like I said, I'm just so impressed. So thank you for joining us tonight, and keep up the great work that you're doing.
Thank you. Thank you for having me, and thank all the panel, all the participants who showed up to come and view the webinar. Hope you got something out of it.
And this will be recorded and available on the MOBIC website. And we look forward to seeing you in the future. And please join future Zoom into Wellness events, which will be held every other Monday from 5 p.m., which is a new night. We have filled the other nights with diabetes programming, and Zoom into Wellness will take over Monday night. So thank you for joining us.